while everybody is coming here, I'm going to introduce Lalis. Lalis and I, we have been working for a lot of time. I'm not going to count the number of years, Lalis, don't worry. A lot of time. And probably Lalis today, nowadays, is one of the main thinkers on customer experience, especially focused on patient experience. A big part of all the theories and all the practices that you can see, that you can read worldwide about patient experience comes from Lali's mind. And it's a pleasure to share with Lalis and Christina our time in the Institute with their company making a lot of great things everywhere in the world. We have been doing, Lalis, a lot of things everywhere in the world. We have a lot of stories that we can share in another seminar, no, not today. Has been very, very good. Okay, today we're going to talk about, now we are formally going to start. I see that the number of participants have been stabilized, and we're going to start. Today we're going to talk about lean and customer experience. And we're going to realize that customer experience is not just to say, hello, very good, to put glitter over the customer, probably is something different. So Lali is going to tell us why customer experience, but I think that we have been doing, Lalis have been doing a very big effort to make that practical. So which is the tools that we have to use to do the customer experience, how this links with Lean, okay, which is the lean tools for a customer experience. And we're going to do that practical. That means that we're going to do that through a patient experience that we can see and we can feel, because all of us have been patients. So Lalis, thank you, welcome, and we're all set.
Perfect, thank you. So it's a huge honor to be here, just sharing a little bit of our experience. And actually, I want to start from the basics. I'm absolutely sure that all of you know about the 5 principles, and the first one is actually defining value. So the first principle is to identify what the customer values and is willing to pay. And this requires actually a deep understanding of the customer's needs and expectation. But then, as you can see, the other 3 principles are about how we can improve internally the company. So actually, 4 years ago, 4 or 5 years ago, more or less, a lot of hospitals start asking us to introduce patient experience into our project. So this is the customer experience. And then we realized that we were working and we were doing a lot of projects. And here you can see a random example, a patient undergoing chemotherapy over several months. And actually, you know, patient comes from home and then they have a blood test, doctor's visit, the chemo administration, and all these things happens in one day, hopefully. So the lean focus was streamlining processes by consolidating everything into one single day. But then we start listening to patients, and then someone said, oh, someone needs to accompany me because after chemo, I'm not able to drive. And then parking can be so expensive. So I'm not very sure if I prefer into only everything in one single day, or maybe I prefer to come in separate days. So we start finding that customer is more they are experiencing a lot of different things beyond the hospital settings. Here, so we realize that probably it's not that we don't know them, but probably we were like lacking of asking a lot of questions. Here you can see another example. So beyond reducing intersurgical times, that in Lean we are very focused on that, do we truly understand the patient's experience before, during, or even after the procedure? And I think that this photo that I took a lot of years ago can express what I'm trying to say. So here you can see trash, no one around, patient clothes are in a plastic bag. So probably we were missing a lot of things. And this is the last example that I want to put on that. And actually, we were working in a patient experience project with pregnant women. And we also realized that it was not about decreasing the spaghetti diagram, because the user told us that they preferred visiting the hospital more often because they like to hear the baby's heartbeat. So we realized that probably lean is very, very powerful, but but it's very powerful to streamline our processes. But then we realized that processes and patient experiences are very related. Actually, in this study from the Veril Institute from the UK, you can see that ask to patients and ask to people that when you think of a good patient experience, how important is each of the following categories? So here you can see that they say that professionals, how they treat to them was very, very important, but also processes. So for us, it was an aha moment because we really realized that lean is a very powerful tool that impact directly to patient experience, but at the same time, we were missing some things only applying the lean methodology. So while lean provides the efficiency and the structure, the patient experience brings us also the empathy and the human-centered focus necessary to deliver a truly impactful care. So that's when we start studying about customer experience. And actually, it's not anything else that the perception customers have of their interactions with a company or organization through the entire journey. Not only the touch points with the company, hospitals in our case, but the whole processes. So the customer experience and a patient journey begins a lot of earlier than when you interact directly with the company. So we need to create synergies between this operational efficiency plus also the customer satisfaction. So we start asking if we know who were our customers. So and again, if do we have a single type of customers, or maybe we have different type of customers? What motivates or concerns them? So here I want to introduce you these 3 tools that we are using a lot. And these 3 tools are to really understand if our customers are the same or they are different. The archetype is like trying to identify universal patterns. But sometimes, once we have these universal patterns, we need to understand a little bit further how these people interact with our service or product. So sometimes we need to create a persona, which is a little bit more detailed, is a detailed and fictional representation of the people who are buying or who are buying our product or service. And mostly we talk about demographics, their behaviors, their pain points, even their goals. In case that we need even more information, normally we also do the empathy map, which is trying to understand not only who are they, but also how they are thinking, feeling, saying, or doing things and interacting with our company. It's true that sometimes we mix the 3 tools depending on the project and depending on the needs. Here you have a simple example with a diabetes person to really understand the difference among the different tools. Because as Uriel told, we would like to be this very practice with real and tangible examples. So here, for example, there are different archetypes reflecting the diversity of attitudes and behaviors among people managing diabetes. So it's not the same how we need to be organized internally if the person that we are treating is different. So here you can see, for example, someone who we can call the overwhelmed newcomer, who is people who is recently diagnosed, with, for example, someone who is the planner, highly organized and very methodical, person, likes keeping everything very detailed and recorded. Then we have the minimalist, manage their diabetes with least amount of effort required. And then the caregiver. So it's not having the diabetes by itself, but this person is caring of someone. So the needs are really different from the different points of view. Imagine that we take the planner. Here you can see an example how we can do the persona of this planner archetype. So here you have Bruno, 52 years old, his account, lives in Barcelona with us, and we start answering this information that allows to imagine and representing someone that could be this planner archetype. And this makes us to better understand their needs, so that we are doing lean and we are doing optimizing internally the processes. We need to understand what they are behaviors and what they are motivations, because otherwise we are taking decisions not in the best way. And here you have the same example, the same person, but with the empathy map point of view. So here we can see how Bruno is thinking and feeling, what are they saying and doing, what is hearing, what is saying, and also linking with pain and gain. And it's true that the three tools are very connected, as I already saying. So sometimes being able to separate them is not easy, at least in our experience. But the point is, depending if you want more abstract from the archetypes to a very more detailed information to the empathy map, you can really understand who are your customers to really make sure that all the improvements that we are doing in the lean perspective are also good for our customers. So once we already
let me say, Lalis, that also if you read from these two tools, okay, from this persona, for the empathy map, you can see how clearly it connects again with processes. And so processes without the customer experience are naked, are nothing. So we really need to put all this customer journey over, or otherwise it's just nothing, that it's not useful. If value is the first principle, how we use processes to serve the first principle. And delivery value is not just at the end of the value stream map, is along all the stream. And so I think that this connection that you can see with these questions that everybody is doing every time, it's fantastic, Lalis.
Yes, absolutely. So once we already know who are our customers, what tools do we have to deeply know and to listen and hear them? And here you have different tools, the fly on the wall method and also the shadowing, that actually both of them are really close to Gemba. So I'm not gonna extend too much on these two, but it's true that these tools, they have little nuances with Gemba. So you also have them, and we are using a lot. So one is that to be quiet, to be quiet and just looking and observing what they are doing, like this one, even hearing. Can you hear the video?
Not actually a thing.
No? Okay. So it can be quite annoying when you really are under a procedure. And the shadowing is when you are following the customer, trying to understand what are the interactions and what is they are doing. And then we also have focal groups or individual interviews. Actually, here you can see that there are plenty of different tools. I was thinking, okay, what tools I can share during the webinar. So it's difficult because there are tons of qualitative tools. So here with this, in this study from the Health Foundation, you can see how they map the different tools. So depending if you need for your study a more generalized or less, or more descriptive or less descriptive information, you can use different qualitative tools. So I think that this is really important because sometimes we always use the same one, but there are tons of chaos questions, SMS questions, or even online ratings that are public, and there are a lot of information that we can exit and really trying to understand how the customers are perceiving our service or products. And once we have all of this, it's like, okay, where all this information is recorded. So we can record it in several ways, and we will see it. Here you can see a real example. This is some templates that we create for a specific hospital because we ask professional cares to do this observation. So we prepare different templates, as you can see here. So there are some professionals doing shadowing, others just taking notes, and others doing observation, like the fly on the wall that I mentioned before. Here also we create these templates to really guide them, because what we wanted is to make sure that the people who were working at the hospital really sees with his eyes how customers were interacting with the services. And then all this information, we record it in a customer journey map. So actually, we are combining the value stream map tool with the customer journey map tool, and we are combining both to really make sure that we are not missing information, and that when we are applying lean and when we are working with processes, actually we also take into account the customer perspective. Because as Oriol mentioned before, both are really linked to each other. So what I'm showing to you are different tools to make sure that the first principle is very strong and we know deeply how are our customers.
I think that this combination that actually you are proposing, so this customer journey map with the value stream mapping both together, this is something very, very powerful, and we have to take note about that.
Yeah. So like once we are here, like it's also very interesting seeing that all these tools is not only to work on existing processes, but we can use all this customer experience tool also to integrate it with other methodologies like the lean startup or design thinking to create some products. So here you can see some tools of the canvas, the value proposition canvas, because also with lean we can create new products and services, and taking into account this customer experience perspective, we think that is very powerful. Here you can see some real examples, and just to make sure that we close, the loop with Bruno, here you could see how from the information that we have gathered through focus groups, interviewing, and thanks to do the empathy map and all these tools that I already show you, probably we could develop new products and service. And then it's the moment to make sure that these product and service are built on the lean principles, very efficient, in a very efficient way. So just to finish and make sure, like three slides left. As Uriel was mentioning before, I think that both methodologies are very powerful when using together. Integrating customer experience is more achievable in companies that adopt lean practices because it allows you to be more flexible. So all those organizations with a standards process and operational flexibility are better positioned to incorporate this customer feedback. Also, customer experience provides methods and tools to better understand our customers. So I think that those companies applying lean are more prepared to understand them. Mapping and understanding processes is critical also to embedding this customer experience effectively. And it's very, very important breaking down silos. So make sure that every single step of the company, of the chain, has this customer point of view already incorporated. And finally, customer insights drive continuous improvement. So I think that this is the one of the main purposes of the lean methodology. And actually, we are trying to integrate this methodology also into the A3. And we start here in the team. Should we, and here, this is a question that I want to share with you, because in healthcare, at least in hospitals, we are having this debate. Should we involve customers from the very beginning of a customer experience project? That means, where do we want to use these tools? Only to ask the customers and then coming back into the company and work together and then go inside, ask again, and go inside again? Or do we want to make them participate in our A3? I know that this is very ambitious, but this is one question that we are talking a lot in the Catalan hospitals. So here, when we talk about the team in the A3, this is one thing that we are already considering. And then actually in the context is the same, no? What is the purpose of undertaking a patient experience project? What is the gap? Do we have data? Because this is a huge problem that we are facing, the data related with patient experience. And then here in the initial situation, we combine lean tools with also the customer experience methodology and tools that I've already shared to have a better initial situation, so to better face the other part of the A3.
Absolutely. So I think that, as you said, with A3s, what is very important is to incorporate customer problems as a problems to solve. Because sometimes we talk about customers, but we really don't know what we're talking about. So to incorporate these customer problems, it's key in the A3. As you said, then, as we have a problem, a new problem, a created problem, we want to solve customer problems that we have never seen, as you said. Okay, we don't realize that when we go to the chirurgical department, we have oral belongings in a plastic bag, okay, that we are left. We don't see that as a problem. Now, when we know that this is a problem, it's a problem to be solved. And which is the best tools to solve a problem? An A3. And then
Exactly.
another thing that you have been saying is we don't want to reinvent the wheel. If there is a lot of very good tools to understand customers, let's use it. Some of them can come from design thinking, other it's about all these shadowing focus groups that have been using for decades all along all different industries, but put them in context, and I think that here Lean is very good. And then this idea of flow. Customer experience is a flow, value stream map is a flow, and this, as you said, the two main topics about the customer, so the people and the process. So I think that this is so simple that it's brilliant. Thank you very much, Lalis. We have some questions. We still have some time for some questions. So we have the first one from David Clift that is saying, can the persona information be collected quickly and use it, and how processes are adapted or selected in real time? So can we take this persona information and solve the problems immediately? So if you see that the bug is a problem, this particular, can you solve it? Or first it's better to have an analysis, see all the customer experience, and then propose the changes?
I think that this is the same as lean. You can apply Kaizen, little Kaizen, little improvements. And I think quick wins are always good for everyone. So you can see that, with all this data that you are collecting, you are already doing things. But at the same time, I think that really understanding who are your customers and what they are perceiving, how are they perceiving your product or service is also crucial, because if not, we can think that we have already solved the solution with that Kaizen. So I would say that combining both would be the best option. I don't know your opinion, Yol.
This is a very good lean answer. So I love that. Another participant asked, how long does it take to this process from the beginning to the end? How typically it takes, for example, in a hospital, but any customer experience?
Wow, this is a very good question because we are actually analyzing this process. I'm not sure if it's that, we have more experience in Lean than not in experience. We have more experience in Lean and not in patient experience. So I don't know if the reason is that, but we are spending a lot of time in the patient experience process because collecting this data, talking with patient groups, like doing interviews, a focus group, you can have 7, 8 people in one focus group. Normally, we recommend around 2 or 3 focus group for the same project. But when you are talking about interviewing, you need to interview around 10, 12 people, more or less. And I know that there are some biography that says that even more. But we know that with qualitative data, we don't want a very big N, but it's true that it's very like you need to have a lot of resources involved on that. So I would say that you can be around 6 months, more or less. And then there's another thing that it's very important. It depends if you want to only listen to patients or to customers and have this feedback and work internally with professionals, or if you want also to involve customers in the co-creation solutions. So depending on the level of immersion that you want to involve customers, that would differ the time spending that you need.
Okay, excellent. There are different comments, for example, from Sarah and David that says that yes, that co-creation is the future, so they believe in that. We have another question. Maybe it's the different question, maybe more controversial. One participant is asking, the perception of a brand is a customer experience? And if the perception of a brand is a customer experience, how we apply this methodology?
Wow, it's a very good question. Actually, it's all. I would say that is it part of customer experience, because actually a customer is buying our products because of our brand as well. So I think that is very important, and I think that it is something that we have to take into account. However, there are several things in a company. So and I think that we cannot confused with those marketing or communications aspects. So I think that, or at least we are focusing that not even to create new products or solutions, but we are also we are using the patient experience to really make sure that the internal processes that we are working on are more powerful and more customer oriented.
So more on this continuous improvement wheel, okay, trying
Yes.
to improve what we're actually doing, because until you don't have it, you cannot experience, okay? But of course, this can be applied to design for customer, as we talk in Lean, to use all this methodology as design for customer. So Lalis, thank you very much. It has been incredible to have you today here. I think that you gave us a lot of insights of something that it's missing, that you always talk about customer first, customer blah, 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 but how to do that with some specific tools. You give us 3 tips. I think that these 3 tools that can make a difference for many of us. So Lalis, thank you very much. And
Thank you.
we enjoy you next time.
Thank
Bye.
you.